were sitting 2 years ago and chose to do a capstone project with the Tobacco Prevention and Control Branch on smoke-free multi-unit housing. And I graduated last May and slid into a job with the Tobacco Prevention and Control Branch. And so now I'm back pitching. We have a capstone team now working on this issue. And so I'm back pitching again. And one of the things that I learned when I was in this program was how to advance PowerPoint slides. So I will use that skill today. I wanted to practice first. Okay, so anyway, I am technically a legal specialist with the Community Transformation Grant with the North Carolina Division of Public Health. The North Carolina Division of Public Health got a grant from CDC. It's a 5-year grant to work on healthy eating, active living, and tobacco-free living. And one of the strategies of the tobacco-free living area is to increase the number of properties in North Carolina that have smoke-free policies, multi-unit housing properties. So I spend most of my time working on that, and a lot of it is programmatic, but I end up doing a lot of evaluation, even though it has nothing to do with my job description, because I was so well trained in this program that if you end up knowing something about evaluation, you get pulled in. And I remember being told that when I was in the program, and it is so true, and you can't help yourself but get into it. So I spent a lot of time on evaluation, and that's what this capstone project is all about. Okay, so smoke-free multi-unit housing. When I first heard the concept of smoke-free multi-unit housing, I, like you, thought it was kind of a strange idea that someone should not be able to smoke in their own home. I have since drunk the Kool-Aid, and now I have the paradigm shift of thinking, well, shouldn't people be able to breathe clean air in their own home? And we also know that since the smoke-free bars and restaurants law was passed in North Carolina 3 years ago, people are much more used to breathing clean air indoors now. So the idea of having smoke-free policies in someone's home are not nearly as radical as they would have been just 3 years ago. So we're in a process of rapid transformation in social norms in this state, so we're taking advantage of that with this strategy. So we know that in multi-unit housing, secondhand smoke can move between cracks in walls and plumbing and open windows, so it definitely does transfer between units. The U.S. Surgeon General has said that there is no safe level of secondhand smoke, and she has recommended that, or she said that the only way to protect people in multi-unit housing from secondhand smoke, the only true way is to pass smoke-free policies. So that's what we work on. And there are disparate impacts in the area of secondhand smoke in multi-unit housing. We know that families with children, the elderly, the disabled, people of color, and people with low income are disproportionately represented in multi-unit housing, and they are more likely to have a neighbor that smokes because smoking is tied to income levels, although the majority of people in all income groups do not smoke. So I'll tell you a little bit about the research that we've been doing in this area in North Carolina, and that the next capstone team, if we're lucky to get one, will be adding on to. So this time last year, I was very busy working on this tenant survey of, which seems like 5 years ago, but it was a year ago, that I was working on this survey of 13 affordable housing properties in Greensboro, and we determined that the majority of the residents that lived in those properties don't smoke, and the majority wanted to live in a building where smoking was not allowed. So that was a good survey to do to show owners and managers in North Carolina how to survey their tenants and to get a sense of what the results were going to be. Because these types of results, you see them over and over again when you survey properties. So another survey that we worked on in the branch that wasn't capstone related, but that I oversaw in September, using some PB grads actually, was we surveyed all of the public housing authorities in North Carolina to determine what their smoke-free policies are. We determined that there are only 3 smoke-free properties in North Carolina in public housing authorities. I spoke to the Public Housing Authority Association on Monday in Greensboro to try to change this, so I'm working on it, but right now we're only at 3. So this is another survey we're working on right now. And this is based on a survey methodology that my capstone team came up with this time last year. And we have now contracted with the UNC Survey Research Unit, Mike Bowling, Robert Agins, to actually conduct the survey. And I and a colleague of mine have been working for the last 3 months diligently creating the survey instrument, and now we're writing the, the interview when you call, how to get people on the phone. We're working on that. You see I'm working too much on evaluation, but anyway, so we're gonna have this survey completed by the fall, and we're using CTG money to complete this survey, which leads me into the next survey. CDC, through the CTG money, wants us to conduct research on impact of smoke-free housing policies, because the research we're doing right now is going to give us a baseline for what proportion of housing in North Carolina is smoke-free. So it's more of surveillance. Now CDC wants to develop the evidence base, and they're looking at this nationwide in all the different states that they've given money to, and we're one of those. They want us to do research to determine what is the impact when these smoke-free policies get passed. So they're not giving us any directive on what that needs to look like. It's wide open. So we might be looking at, does this impact the health of residents? Does it increase smoking cessation rates? Does it improve air quality? Does it result in cost savings for owners? There's just a wide variety of outcomes that you could measure and study. So what I need a capstone team to do is to look at the literature that's out there, that's been like in the past when there have been smoke-free workplace policies. What did they measure? What outcomes did they look at? What have other states been doing? And this is brand new baby research. There's not a lot out there, but it will involve getting on the phone with other researchers from around the country that are working on this issue and figuring out what is the best thing to study in North Carolina. So we need a capstone team to develop research questions to figure out what data in North Carolina might already be out there that we could use. A big thing is, can we get the cooperation of the owners and managers and the residents to work with whatever evaluation we want to conduct. Luckily, we've got really strong relationships right now. As a result of what we've been doing over the past year, we've developed relationships with people all over the state. But whether that would then translate to us going in and studying like health impacts on residents, I don't know. So this is something that the capstone team has to, am I finished? Oh, I'm sorry. Okay, I thought y'all were gonna like hold up things. Okay, they're the deliverables, evaluation plan, and you're gonna learn a lot of evaluation and community engagement. So thank you.